Good morning, Scientist Pimpin. I currently have many patients that have different infections in different locations that are not healing. They started out as a staph infection but are not reacting with the common medications for a staph infection. The patients seem to all have the same or similar signs and symptoms. The infections are showing up on the skin or in soft tissue areas. Their appearances are similar to things such as boils, abscesses, and pimples. The more alarming infections may be ones that are pus-filled, warm, reddened, or swollen. The infections are also occurring most oftenly in areas that are covered by the hair like the groin, head, or axilla. In the beginning of the infection, they look similar to a common spider bite, but as they progress with an infection, they are transforming. The infection can be at a single location or multiple locations. Other common signs and symptoms coinciding with the infection seem to be pain, fever, malaise, or fatigue. It seems to be occurring with patients that are being treated for pneumonia, urinary tract infections, bacterium, sepsis, and surgical wound infections. It is also presenting itself in infections such as folliculitis and boil cellulitis. Is there any type of test we can run to help diagnose our patients because the infections appear to be resisting our common medication?
Wow, Dr. Walsh. Well, I'm really swamped with a lot of requests for lab results. And all my lab technicians are at lunch right now, but it sounds like to me it's MRSA. You find that staph bacteria to the body that's normal, and you know that the bacteria has a mutation that makes it resistant to any antibiotics that you prescribe to your patients. Have your nurse take a swab of the infected side of your patients, and then from there, have that swab and culture sent back to the lab. I just wanted to let you know there are 3 different types of lab mediums that I use. But first I'll isolate the Staphylococcus aureus, then culture the bacteria and let it grow in the presence of the antibiotic methicillin. If the bacteria grows in the presence of that antibiotic, the bacteria is resistant to the antibiotic, and therefore it's called MRSA. You want to hear something cool? There is a technique that uses fluorescent markers to determine if the DNA is a strain for that bacteria of MRSA. This method is actually a lot quicker and more proficient than traditional methods such as using the agar or the coagulase test. So once I get my lab technician to do all this, I'll have the results sent back to your department and figure out, what's your next step.
Okay, thank you. And then I can set up a treatment plan with my nurses.